now that we set the background for just how does rehabilitation and exercise apply to cancer in general, now we're going to just jump ahead a little bit to talk specifically about the brain tumor patient population. So anecdotally, just thinking about it, everybody always thought and knew, well, obviously rehabilitation has to help patients with brain tumors. But Wendy asked an excellent question. Do the insurances pay for it? And more nowadays, the insurances are looking for evidence-based medicine. They're not going to pay for something unless it can be proven to them that it's helpful and that it's effective. They're not going to go just by someone's opinion or thought that something is helpful. They want to see the cold, hard facts that literature has shown. So an organization called the Cochrane Collaboration out of Australia in 2013 did a huge study, the multidisciplinary rehabilitation after primary brain tumor treatment study. So what they did was they reviewed medical literature, thousands of articles, to assess for the effectiveness of this multidisciplinary rehabilitation team approach after brain tumor had been diagnosed in patients. Because of the nature of the population, they couldn't find any definite randomized or controlled clinical trials available to come to a definite conclusion. However, they were very clear in saying that gaps in the research should not be interpreted as proof that multidisciplinary rehabilitation for brain tumor patients is ineffective. It highlighted the challenges in trial design. Of course, it's very difficult to take even two patients with similar brain tumors and randomize one to get certain types of rehabilitative therapies and not randomize the other to get the same rehabilitative therapies. It's a challenge in this patient population, and it was recognized as such. So, but further study into the literature talked about much more specific details. So EBM again stands for evidence-based medicine. And further review of literature showed that patients with brain tumors have functional gains when treated with rehabilitation therapies comparable to those of patients with stroke in the acute rehab setting. That's a huge thing. That's a huge fact to be able to present to the insurance companies who don't want to pay for insurance for whatever reason, to say, but look, you would pay for XYZ for a stroke, but you won't pay for a brain tumor. Here are studies of showing that the results are similar. In fact, patients with brain tumors in some of these studies had a shorter length of stay, so they stayed in the hospital for a shorter period of time than stroke patients. And like stroke patients, brain tumor patients had a very high success rate if they were admitted to a rehabilitation hospital of being discharged back home to the community, which is a big benchmark of success for rehabilitation. And for certain types of tumors, for acoustic neuromas, it can cause problems with balance, hearing, and such forth. And there are certain types of therapies called vestibular rehabilitation. Also, like lymphedema, it has to be performed by a specially trained and certified therapist who's trained in vestibular rehabilitation. But it's also been shown that that improves postural stability, both standing still and dynamic with walking, ambulation. And also, the patient, him or herself, felt a decreased perception of loss of balance as they were recovering when they received the proper therapies. And I'm not going to go, I could synopsize all these articles, but I'll just suffice it to say that I reviewed the literature and I found literature, it's international, it's global right now, what's spanning the cancer rehabilitation and brain tumor rehabilitation field. There was a huge Italian study in the Journal of Neuro-Oncology from 2012. Case Western Reserve, which is a premier medical center in the United States in Cleveland, published a study in the American Journal of Physical Medicine and Rehabilitation in 2011. Korea, in 2012, in a journal Supportive Care in Cancer, had a large study which showed that rehabilitation helped patients reach significant gains, those with brain tumors. The Netherlands published a similar study in 2011. The United Kingdom published another study in 2011, and even Canada came out with a study in the Journal of Neurology. So the bottom line is that the main common denominator of all these studies was that rehabilitation should be integrated with neuro-oncology and palliative care services to provide appropriate treatment for each phase of the brain tumor cancer survivor journey. And I also just want to digress for a moment because it is somewhat related. Sometimes there is overlap between those with brain tumors as well as with spinal tumors as well. So spinal cord injury is a large field of medicine within my field of medicine, rehabilitation medicine, which there's been a great deal of research and data accumulated over the years. And it's pretty much accepted that spinal cord injury rehabilitation is effective and works. But again, there was doubt about the fact, okay, well, it'll work on a traumatic spinal cord injury, but the insurance companies may say, why should they pay for someone with someone who has a metastatic process affecting their spine? But again, the study showed 84% of patients with neoplastic, meaning cancerous, spinal cord compression, spinal cord disease caused by a cancer that spread, were discharged home from the rehabilitation hospital, and 75% of those maintained their functional ability with mobility, gait, and transfers 3 months out. These are very big numbers when we're talking about rehabilitation. Patients with metastatic spinal cord injury demonstrated improved progress in an inpatient spinal cord injury unit, and actually they were found to have similar functional outcomes as patients with traumatic spinal cord injury, and actually had significantly shorter lengths of stay. They got home sooner than patients with the traumatic spinal cord injury. So no matter what the field of cancer is, there's increasing evidence and literature that exercise and rehabilitation helps, really makes a big difference. ACOs, accountable care organizations, are a big trend in the future, and there's something you may or may not have heard of. If you haven't heard of it, you will be hearing about it. It's something that's going to be playing a major role in medicine in the future, and one of the goals of the accountable care organizations is looking at population health, looking at large populations and shortening those patients' population length of stay in the hospital, as well as reducing admissions and readmissions. And cancer rehabilitation focuses in on specific criteria which are going to fit in very nicely to the world to come in accountable care organizations, because it looks at both patient and caregiver experience of care. Cancer rehabilitation, brain tumor rehabilitation is very focused on making sure the person can become the maximum potential that they can. It coordinates care within a team approach. It's very focused on patient safety. It works on preventive health as well. We talked about how many of these exercises actually can prevent recurrence and complications. And it's a very at-risk population and an underserved population, because for the most part, cancer patients, brain tumor patients do not receive the rehabilitation therapies that often that they probably can. I talked a little bit about limbo before. So limbo can be defined again as a state of oblivion. You're neither here nor there. You can be in a state of limbo. It's been found when someone gets diagnosed with cancer, in that period of diagnosis until they begin treatment, but also they're often left in a state of limbo after they complete their treatment, because they're used to medical staff watching everything they do, every step they make, every move they make. But then once they finish the treatment, they're done, and they're told to go on with their new normal, their new life. And that's where the whole survivorship plan comes into play that I referenced to earlier. So one of the goals of rehabilitation is to help patients avoid being in the state of limbo. So first, patients can be diagnosed. Then there's something called prehab, which is not unique to cancer rehabilitation. Prehab means getting some therapy before the fact. So very often before someone gets treated, they will actually sometimes begin an exercise therapy program. This is common in the orthopedic world. Someone who is going to undergo an orthopedic elective procedure, it's been shown many times, will have a better outcome if they exercise before and strengthen their muscles before the procedure. The same thing if someone has been diagnosed with cancer, before they initiate treatment, if they get active in some type of exercise or therapy program, it's been shown that they have better outcomes as well. Then often comes the treatment, but that's not over. Then comes the rehabilitation, either during or after the treatment. And Dr. Julie Silver from Harvard, who's a physiatrist, a rehab doctor such as myself, who's a leader in the field of cancer rehabilitation, talks about prehab as protection against the coming storm. Again, just to talk about breast cancer as an example, scientific evidence has shown that women with breast cancer who were randomly assigned to a physical therapy program 3 months before undergoing surgery achieved 14% more range of motion, meaning ability to move their extremity, in the involved shoulder than women who did not undergo physical therapy. And when they followed these patients at 6, 12, and 24 months post-out, they continued to make gains. So this is also kudos to Dr. Silver. She used the term saved by the bell, meaning that oftentimes when patients are finished with treatment, the bell rings, congratulations, they're done, they're sent off, they're on their way, and that's when patients find themselves in this state of limbo. But Dr. Silver calls for the bell not just to be an end to treatment, but a call to action for healing, to encourage the patient and the family to continue with exercise and therapies for an improved quality of life. And I just want to close by saying hospice is even beginning now to play a role in the whole spectrum of care. There was a very interesting study out of India, Indian Journal of Palliative Care, which talked about the various mechanisms in which rehabilitation therapies can help patients on hospice. Because hospice is all about living your life and quality of life for the time that you're present. And they can work on pain management, positioning, endurance, gait training. They can help a patient with home modifications and equipment to maximize their function at home. There are loads of references. If you're interested in your spare time to read, I can share this with you. But in a sense, really in essence, my take-home message is that for patients with cancer, brain tumors included, there's a whole host of deficits which exercise and therapy really can help, and that, of course, each person is individual. So there's no cookie cutter format that I could say is good for everybody, but I do encourage all patients with various brain tumors and cancers to speak with their doctors, get medical clearance for exercise, start on an appropriate individualized therapy or exercise program, and it really has been shown to help.